Well,
I'm
welcome.
gonna.
So it looks like we're about 46% of the folks on the call today have considered a health career and about 54% have not. We know that that number is a little bit probably wonky just because we have folks joining us here from their individual computer, from classrooms, and with individual families as well. So that is super exciting. I'd like to just say welcome. My name is Marie Caldwell. Welcome to Health Careers, our STEM webinar today. We have lots of wonderful panelists joining us to give you a wide view of what is available in our county as far as health careers. My name is Marie Caldwell, and I represent SiskiyouWorks. SiskiyouWorks is a workforce development project here in Siskiyou County, linking industry and education to change the talent pipeline in our county. We have awesome jobs. We have a wonderful place to live here in Siskiyou County, and we need to make sure our students understand and are connected to the opportunities that are here. You're here today because you're either interested in hearing about what kind of careers in health are around the county, or your teacher made you sit in the classroom to listen about it. But hopefully, regardless of whichever you're here for, you'll find our panelists interesting and be impressed by the wide array of opportunities to work in healthcare. Just because you may not want to be a doctor doesn't mean that you can't work in healthcare and support the health and betterment of our community. I'd like to introduce Christina Van Alphen, who's also here to welcome you today from College of the Siskiyous. Christina?
Thank you, Marie. Hi, everybody. My name is Christina Van Alphen, and I'm from College of the Siskiyous. We are the local community college that helps train people who are interested in careers in healthcare. We have training programs in emergency medical services, nursing, police, firefighting, and training for other careers. We have campuses in both Yreka and Weed. So today, our Director of Nursing, Rhonda Brown, will be talking later about our nursing program. And our Emergency Medical Services Director, Kirk Thompson, will also be discussing our EMT and paramedic program. I hope you find today interesting, inspiring, and informative. Now back to Marie.
Thanks, Christina. So I have the pleasure of introducing our keynote for today. I get to introduce Caitlin Van Hoosier, and she graduated from Yreka High School in 2013. I tried to make you lots younger, Caitlin. And from CSU Chico in 2017 with a bachelor's in molecular and cellular biology. She started medical school at Ohio University Heritage College of Osteopathic Medicine in 2017 and is graduating in 2022. While at Chico State, she worked as a health administration intern at the Chico State Student Health Center and was a student leader in the college ministry organization. She didn't put it in here, but I know she does a whole lot of yoga too. As a medical student, she has performed research, been the president of the Biomedical Ethics Club, and volunteered over the last 3 seasons as medical staff with the OU men's ice hockey team. When she is not studying or volunteering, you can find her at the OU gym teaching a cardio dance group fitness class. She is currently completing her clinical rotations in Southeast Ohio. And we are so excited to have you here, Caitlin, to share with our students the pathway that you took. I'll turn it over to you.
Yeah, I'm really happy to be here. So like Marie was saying, I graduated from Yreka High School in 2013. And I really wanted to be a veterinarian when I was in high school. Like, that was all that I could ever talk about. And I went to Chico State with the plan of becoming a veterinarian. That's why I chose the biology major that I did. But working at the Student Health Center kind of like turned me on to human medicine versus animal medicine. I just absolutely loved working with the other patients and the other providers, and I learned so much from them. After I graduated from Chico State, I applied to medical school and actually got in on my first try. and got into OUHCOM, or Ohio University Heritage College of Osteopathic Medicine, which is a huge mouthful. So I just call it OUHCOM. And so far, med school has been like one of the hardest things I've ever done, but I've also just absolutely loved it. I am studying to become an osteopathic physician, which is a little bit different from the like normal like MD physicians that you see. So my degree will actually be a DO, and we get all of the same training that MDs do. As far as medical training goes, we are able to be licensed in all 50 states with a full medical practice. We can perform surgery, we can see patients, we can prescribe medicine, all of that good stuff. But we just have a little bit of extra training in something called osteopathic manipulation, which is using my hands to diagnose and treat the musculoskeletal system. So that's just a little bit of the difference between MDs and DOs. Typically medical school is a 4-year degree. So on top of the 4-year undergraduate degree that I got at Chico State, this is another 4-year degree. And like Marie said, I started in 2017. But during my first year, I actually had some academic difficulties and family difficulties that kind of all blended together. And I really didn't do too well my first year. And I ended up taking a leave of absence for a little bit just to kind of help my family get things back together, back to normal a little bit. And then I restarted in 2018, which is why it's going to take me 5 years to get through medical school, but that's okay. Over the summer, I passed my first set of boards, of medical boards. There's 3 exams that I have to take in order to become licensed. And now, after I pass that, I'm on my clinical rotations, which is your like second half of medical school, where you get like on the job training, which has been a lot of fun so far. And looking ahead, after I graduate, I'll have like 3+ years of residency training, which is paid on the job training. And then any extra training I get is called a fellowship. So it'll be like 1 or more years, depending on what I want to do. So it's a long road, but like I said, I've really loved it. It's been hard, but it's been really enjoyable too. I was asked to talk a little bit about kind of like my journey, which I just shared, but also some stuff that I think is important for 8th graders to know, and like going into high school and to know about health careers. I think the biggest thing for me that I would want somebody to tell me if I were an 8th grader again is to be really curious about things and look for the things that you love to do. And also to stay open-minded about things. Like if you don't immediately like something, that doesn't mean that you're not going to like it in the future. For example, I absolutely hated science classes in 8th grade and a little bit less in high school, but like middle school, I did not like my science classes. They didn't make any sense to me. I never had any fun in them, despite my teachers trying their best to make everything fun. I just did not like it. But then, getting into high school, I started to understand it a little bit more. I started to like it a little bit more. And then once I got to college and started taking my biology classes for my degree, I found out that I actually really liked it. And I was kind of wrong about it when I was in middle school. So just because you don't know if you're going to like something doesn't mean that you shouldn't try it out or you shouldn't keep pursuing it, because that kind of thing might change down the road. As far as going into high school and things that you can do to like help prepare yourself if you're interested or in health careers, or you don't know that if you're interested in health careers, is to take courses and classes that might be related to that. So like I said, like science classes are going to be really helpful for that. So physics, chemistry, biology, like all of those things are important to know if you go into any health career. And I don't know about any of the other high schools, but I know at Wairika High School, there's several health related classes that you can take. And like some of them, like you get to go to the hospital and shadow. Others, like you learn about anatomy and medical terminology and like all kinds of different stuff. So I know that all of those are really important to take just to find out if you're interested. And there are a lot of opportunities, and you're going to hear more about them today, to stay in Siskiyou and still be in the health field. You don't have to do what I did and go across the country to go to medical school. But there's so many options at COS and at the different hospitals in Siskiyou County that if you wanted to stay home, you absolutely, or like if you wanted to stay in Siskiyou, you absolutely could. And if you wanted to leave Siskiyou for a little bit and then come back, which is like a little bit of what I'm planning to do, that is also like a really good option. And I think the last thing, I'm going to take some questions here for a few minutes, but I think the most important thing is, like, when you hear about, like for medical, to become a physician, you get the 4 years of undergrad and then the 4 years of medical school and then the 3+ years of residency. That sounds like so much school, and it is. It's a lot of school, and it's a long road. But in my opinion, like the time is going to pass anyway. So if this is something that you are really passionate about and really want to do, then go for it. And it doesn't matter how long it takes you. If that's what you're meant to do or that's what you want to do, then do it. So I don't know if we have any questions. I think I got a couple more minutes.
We don't have any questions yet, Caitlin.
Okay.
Any questions from the classrooms? We are really blessed today to have both someone who is in the process of probably one of the most challenging and longest paths to a medical career, and then we're going to have a whole variety of other individuals that are going to talk about their different part of the health career pie, and that's pretty exciting because you'll see as we go through the process here today, the webinar, that you can do things, something as intense and heavily educational as far as how long it takes you, like the path that Caitlin is in, or something that is shorter and can be done with a certificate or a shorter education path too. So, Caitlin, it looks like we are good. You are on the ER rotation right now, correct?
Yep, in the DED, I'm actually sitting in the call room because it's like one of the only private places in the hospital. So after this, I'm going to go out and see some patients.
Awesome. Well, we're super proud of you, and go out and represent Siskiyou County, even though it's way out in Ohio.
Will do.
All right, thank you. So webinar participants, we are going to move to the first part of our webinar today. We have two paths of professionals to be able to hear from today. Our first path is going to be around public health nursing. So you're going to hear from the Director of Public Health in our local county. You're going to hear from someone who does some correctional health support, which is at our jails. You're going to hear from a school nurse who works in your schools and deals with students. And finally, you're going to hear from a health educator who is who works with students to push out healthy training for healthy living. So we're super excited. I'm going to pass it on to Shelly Davis, our Director of Public Health. And then Shelly, if we could just ask panelists to give a little, just a shout out to the next person as they pass the baton. It's all yours, Shelly. Shelly, you're muted.
As we're bringing Shelly on,
Shelly, you're muted.
We have a poll.
Oh, there we go.
I'm going to launch a quick poll here too, Shelley,
Okay.
as we bring you on.
Okay, very good. I just want to shout out to Marie. Thank you so much for that. And Caitlin, it's wonderful to see what you're doing in your career path that you have chosen. And do we want to wait till the
Shelley,
poll is over?
Yeah, I'm afraid that we practice this, right? So here we go, students. We practice this activity. We do a dress rehearsal, so to speak, and then we still forget our parts. So know that that happens all the time. As Caitlin said, if you don't like something at first, or you're not really good at something at first, you just keep practicing it or investigate, and from there, you might find you love it.
So do you want me to wait until the poll is over?
I would give it just a few minutes, and then maybe like one more minute, and then we can go ahead and start, Shelley. Thanks.
Very good, thanks.
Okay, I went ahead and took a screenshot, so we can move forward.
Okay.
Okay, we're ready. I wanted to say hello to everybody. I'm Shelley Davis. I am the Director of Public Health here in Wairika. I'm also the Director of Inmate Health and also the Director of Nursing for Siskiyou County's Health and Human Services Agency. A lot of titles, a lot of hats we wear when we live in small communities. A little bit about myself. I was raised in Siskiyou County. I actually attended and graduated out of Montague Elementary, went to Wairika High School, and then this is my second career. I worked as a business owner in town for about 30 years and decided to go to College of the Siskiyous and receive my degree, and decided to go into nursing and healthcare. At that point, I graduated as an advanced degree nurse out of College of the Siskiyous in 2013. And then I furthered my studies directly after that and received a Bachelor's of Science from Simpson University in Reading. And then I continued right on to my master's degree in nursing at Oregon Health Sciences University. And I just say that because I did all of that without ever leaving Siskiyou County. And that's something that we have available to all of us here. We have great educational platforms to attend. As far as my position here at Public Health, I've been in this position for about 5 years. And prior to that, I was a correctional nurse in the jail for about 3 years, which is an interesting field in itself. And Gabby Ellison is going to talk about that in a little bit. But some of you might be saying, well, what is public health? Public health is really, it's more of a science of protecting and improving the health of families and communities. And we do this through promotion of healthy lifestyles. We do this by researching disease and injury prevention, and by detecting, preventing, and responding to infectious diseases, communicable diseases, as you could say. So many of you right now are familiar with COVID-19. And right now that is very challenging in my field here at Public Health because we have been in a state of emergency since about March in regards to COVID-19. And something you might not know is that COVID-19 is the world's first pandemic in the last 100 years. And that our team and I are guiding our county through this historical time. learning from it, taking notes, making new plans, and that's what we do. One of the things that we do in regards to COVID-19 is that we gather information from a positive COVID patient, and we find out who they were in contact with in the last week or so. And then our staff here at Public Health calls every one of those people, and they find out on a daily report from them for their quarantine time, if they had been in contact, if they've developed any symptoms of COVID. Another task that I can say that we recently participated on top of COVID was a natural disaster here in Siskiyou County in regards to the Slater and the Red Complex fire. And when public health is involved, it's when communities become evacuated because their houses are at risk of either burning down or flooding or something like that. And those communities of individuals have to be sheltered somewhere. And this time with this Red Complex fire and the Slater fire, we had approximately 400 people in shelters here in Wairika, between here and Wairika and Mount Shasta. And so what does public health do? We check on those individuals every day on their health status. We work very closely with the Red Cross and their nursing people that they bring up from all across the nation. And we provide any medical services that those individuals may need while they are sheltered. We also look at air quality control and how that affects you as students, how that affects the rest of us, how it affects businesses. And we put out a lot of advisories, health advisories in regards to that. But what I can say about my position is, and the thing that I love most, is that I have truly witnessed how our communities have come together in ways I had never dreamed of before. Because through this COVID pandemic and through the natural disasters, I have seen where Siskiyou County has formed a really tight collaboration between the county, between the cities, businesses, and the communities. And what we're doing is we're all trying to prevent any further devastation to not only to our immediate health, but also to the economy of our county. To go along with that, Public Health has upwards of 20 programs that we offer through Public Health. And I just thought maybe I could just kind of hit on a few. You might recognize some, you might not recognize any of them, but some of these have nurses in those positions, and some of these have health educators, which you're going to hear from one of our health educators here in a little bit. But if I could just throw out some of the names of those programs is we have the CalFresh Healthy Living SNAP Ed program, California Children's Services, which deal with disabled children and getting them medical treatment and medical equipment that they may need. We have the California Children's Health and Disability Program, ensuring that children have proper dental appointments, proper medical appointments. We have the Tobacco Education and Prevention Program, as well as an oral health program. We have a very robust emergency preparedness program. We work really tightly with the Office of Emergency Services, as well as California's Office of Emergency Services. We have the Maternal Child and Adolescent Health Program. We have the WIC program, who you're going to hear about in a little bit from Tracy on here. We also have the Healthy Siskiyou Mobile Clinic, which also offers a safe syringe service program. We offer immunizations. We offer home visiting. We have foster care nursing. Now we have an array of contact tracers that are here. And again, I'm also the director of inmate health. We have that. And I also have behavioral health nursing that I oversee. So you can see there are a lot of different aspects of nursing, and it's not always strictly in a hospital setting. And so I just welcome you to look more into public health if that is something that you're interested in. So with that said, I would like to go on to Gabrielle. We call her Gabby Ellison, and she is a correctional nurse at the Siskiyou County Jail.
All right. Hi, everyone. I wish that I could see everybody's face. This whole virtual thing still new to me. So like Shelly said, I am the correctional RN over here at the Siskiyou County Jail. Even though I work here at the jail, I am employed through public health. So I work really closely with a lot of the programs that Shelly mentioned over at public health. We collaborate a lot. And like Shelly was saying, with the whole COVID pandemic, the natural disasters, the Slater fire, we're still called to go and help with those. So I know that a lot of us nurses over here at the jail went and helped at the shelter as well. So before I put up my PowerPoint, I kind of wanted to show you guys. So this is our, I don't know how well you can see it. This is our jail medical room. So you can see here, we have our exam table. And this is kind of where I work. We got all of our equipment, counter space, and all of that. So I know that some people are kind of interested on what our office looks like. So let me put this on. Okay. So correctional nursing is part of the nursing profession. We care and treat for inmates and other detainees in correctional facilities. So although that I work in our local jail here, correctional facilities also include our state prison systems, federal prisons, and juvenile halls as well. So I wanted to talk about the different levels of nursing, similar to Caitlin and Shelly. All of my nursing education came strictly here from our local College of the Siskiyous. I started out as a CNA, worked up and did the LVN program, finished my RN program at COS, and then went on to get my bachelor's. So CNA is a certified nursing assistant. They provide basic patient care. They assist with ADLs, activities of daily living for patients. And the next step up in nursing is LVNs, the licensed vocational nurses. They have a little bit of a larger scope of practice, so they're able to do, for example, blood draws, a little bit more advanced skill practice, and they also oversee some CNAs. And then the next level is an RN, a registered nurse, and the RN has does more of the assessment side of nursing, so they still have the same skill basis as an LVN and a CNA. So in the diagram that I have here, I kind of wanted to depict here that it builds on each other. So even though an RN is, maybe like the higher level of nursing, doesn't mean that they're above. And I guess in the sense they are, they kind of supervise over the LVN and the CNA, but they're still able to do all the skills as an LVN or a CNA. And then over here, once an RN gets their license, they're able to advance their education into different. So here we have an ADN, which is an associate's degree of nursing. I received my ADN degree through COS. So that takes approximately 2 years to obtain. And then from there, you can go on to get your Bachelor's of Science in Nursing or your BSN degree, which usually takes about an additional 2 years. And then from there, you can go on for your MSN or a Master's of Science in Nursing. This degree or level of nursing is more of like a leadership role. And then the highest nursing level is a doctorate of nursing practice. So this could be like an FNP or a family nurse practitioner who can also prescribe medications similar to a doctor, may have their MSN or their DNP. So I have a poll question. It's not one that pops up, and I know that I can't hear all your guys' responses, but just kind of think a little bit about what kind of services do you think that correctional nurses provide? Do we provide basic care, emergency care, phlebotomy or blood draws, end of life care, respiratory care, physical therapy, dental care, or do we just do it all? So in correctional nursing, we wear many hats in our line of work. We are really the only medical, at least here in our local jail, we're the only medical staff that's on site. So we're responsible for all sorts of services and care for our patients, which is different than the traditional hospital nursing. So our responsibilities here as correctional nurses, you can see here I have a list of our responsibilities, our job duties for what we do. Most of these are pretty similar to what you would see in traditional nursing in a hospital setting, for instance. But here in blue, these ones are specific to correctional nursing. So for correctional nurses, we perform medical clearances. When we have a detainee, somebody that got arrested from home and is about to get incarcerated, they may come here, they may have some wounds, or they may have been in a motor vehicle accident, something of that nature, where we're very limited on our resources in-house. So we may send that individual to go to our local hospital, majority of the time it's Fairchild, to get what we call a medical clearance. So where somebody can do a little bit more advanced testing and assessment on that individual and make sure that they're okay. We also perform a 14-day health assessment. This is specific to corrections, but it's also very similar to a yearly exam that you might get out in the community at your primary care provider, or like a physical exam. Anybody that stays and is being housed, incarcerated here, needs to have that 14-day health assessment prior to their 14 days of incarceration. We do stand-in nursing for physician sick calls, so it's very similar to being out in the community, where you might get roomed by a nurse, and the nurse might ask some questions prior to the doctor coming in for your appointment. Similar to that, our nursing staff, like I said, is really the only medical staff that's on site, and we're not here 24 hours. And our physician comes once a week. So our physician relies a lot on our medical staff, and primarily the RN especially, because we're doing that assessment. We're basically the eyes and ears of that doctor. And here you can see we are responsible for maintaining current and accurate count of all of our controlled medications, such as Ativan, tramadol, things of that nature that are a little bit more regulated. But I also have sharps, and again, that's specific to us because here in corrections, the number one thing for us is safety. These individuals aren't here for good reason most of the time, and so we want to maintain the safety of not only ourselves and those that are around us, but the safety of the facility as well, and those other individuals. We don't want anybody getting hurt, and so we make sure that we keep an accurate count of our sharps. We also conduct lab testing. So here we do our lab draws. and we will spin our blood here, and then the blood gets sent out. We do COVID testing now as well here, and then it gets sent out to our lab. So aside from what you might see in the hospital setting, you have specific lab techs that are responsible for collecting these specimens, where again, that's just one of the hats that we wear here. I'm going to skip over this red one. So down the next blue one, observation of administrative segregation. So what we shortened down, we call it ADSEG. So that, for the most part, is used for disciplinary issues. Most of the time it's used also as like a psych overflow for psychiatric patients. But administrative segregation, they are segregated from the rest of the general population of inmates. So these individuals are in a cell by themselves. They are able to have access to their day area, but it's by themselves. So these individuals, for lack of a better word, don't play well with others. And so they're that, they don't have that human contact and that interaction. And so we do our due diligence and make sure that we check on them and make sure that their safety is okay, that their mental status is okay. We don't want anybody having any kind of suicidal ideations, things of that nature. And then down below, again, review grievances. So that's specific to corrections. Our inmates, if they feel like they didn't receive the care that they needed, specifically, the medical care that they received or the medical treatment that they received, they have the right to grieve us. And that's a whole process within our facility. But basically, it's letting us know that, hey, this individual isn't okay with how they got treated or what came their outcome of their medical appointment. And here we have maintained statistical data. So as an RN, I am responsible for maintaining our statistical data here for our department, and that gets reported off. I report that off to Shelly. And we just look at that every year and we track that. We see how many people are coming in that are on medications, how many communicable diseases did we have for the year. And we try to, what I'll talk to you about later is we try to improve that. Like how can we keep these people safer and just improve our department as a whole. And so these two that are in red, these are two things that you may see in traditional nursing and hospital settings, but in corrections, we also have it, but it's a lot more expanded on. So here we have initiate protocols or standing orders. In the hospital, everybody has a standing order for if their temperature is above such and such, you can give Tylenol. Here, an RN, specifically only an RN, can practice off of what we call standardized procedures. So these are, it's a whole booklet of protocols and orders for medications that our doctor that oversees our medical department has said, if somebody comes in with XYZ, you can go ahead and prescribe this medication. So it really gives the RN a lot of autonomy. Again, this is specific only to an RN. We do have 2 LVNs that work in our department, and so those LVNs are able to receive orders from the RN and the doctor. So really the RN here, for the most part, is standing in for the physician. So sometimes we get to wear the hat of the doctor too. And for providing psychiatric care, I know that, and later you'll talk to, you'll hear from Rhonda. So she was one of my clinical instructors when I was going through my RN. And I remember I was never going to be, I never wanted to be a psychiatric nurse. And now in this day and age, really we're all psychiatric nurses. So the same patient population that's coming through the ER is the same patient population that we deal with here. A lot of the times when we receive these individuals, their mental status has just deteriorated for numerous reasons. And so we have to keep those people safe, not only from themselves, but from other people. We need to make sure that we're being considerate of their mental health situations. And it's not always easy, you know, coming into facilities such as this. So here, I just wanted to show some pictures of some of the things that we've seen here in medical. So we get a lot of abscesses. So here, this individual, this was an arm of an individual, and this was an abscess that they came in with. That we ended up actually having to do a incision and drainage and clear it out because it was very infected. Here, and I probably should have warned you, I'm sorry. So if you have a weak stomach, you know, first thing in the morning, yes, and they're not very graphic, but I know that some people's stomach is a little uneasy. So here we had an individual who had an injury prior to incarceration, and we had to do all of his wound care and treat his wounds. And so this was one. This, it's kind of hard to tell, but this is an abdomen, a stomach. Over on the right side of the stomach, you can see the belly button kind of up from my fingertips. And this was an abscess that we saw. So this individual just casually, nonchalantly, oh, I, you know, had this red thing for a couple days. So these are the kinds of things that are coming through. These individuals don't always take the best care of themselves either. So we're really their first line of medical care. Here, we had an individual have a double ingrown toenail on both sides bilaterally. And so our medical doctor removed those ingrown areas, and we did that all in-house. And so now we are still checking on that individual and making sure that we're maintaining and cleaning the area and making sure that no infections happen. We see a lot of skin disorders here. So these individuals, again, they come in with this. So it's not like they develop these rashes in-house here. A lot of these individuals, again, just don't seek medical care on the outs prior to coming in. So earlier when I showed you that area that was all blacked out, and I said that this individual had received wounds prior to incarceration, this is what it ended up looking like. So our medical staff did a really, really great job at providing wound care for this individual, scheduling appointments for him to outside providers, and we were able to make sure that he was able to keep his foot and didn't receive any kind of infection.
That is fantastic.
And this
Holy moly, Gabby, you've got the ick factor down awesomely.
I know.
Well,
It's fun.
and
I wanted to show us.
well, we thank you so much for just sharing some of those crazy things that you cover and you address in the jail system. We are going to pass it on to Tracy Sandall at this point, who works in women, infant, and children nutrition area. Does anybody have any quick questions for Gabby?
Please do use that Q&A feature at the bottom of your Zoom window. Teachers, feel free to collect questions from in your classes. Type them on in there. We will be monitoring that, and when we have pauses, we will be happy to bring the questions back to our panelists. Thanks, Marie.
Sure thing. So Tracy, I guess we're gonna pass it on to you next.
Thank you. Hi, that's a tough act to follow. So I'm Tracy Sandall.
Gabby, I need you to stop sharing your screen, pretty please. You're good, Tracy. Thank you.
Okay. I'm Tracy Sandall, and I work in the nutrition area of public health. So just a little bit about myself. I actually was born here in Siskiyou County and moved away when I was very young and grew up in Southern Oregon. From there, lived in several states across the US and eventually came back to Siskiyou County to raise my kiddos. So I owned also a small business here in town, and at that point decided to go to work for the WIC program, which is Women, Infants, and Children. So our program, we teach nutrition and breastfeeding information to families in our county. We serve our county. We see approximately 1,000 mothers and children in 1 month, every month. And so we travel all over the county. We go to Tule Lake and Happy Camp and all across the county to provide those services to our moms. The services that we give education. We teach moms healthy eating and activity for their kids and also for themselves prenatally, which is while they're pregnant, and then postpartum, which is after they give birth to their baby. And then we also provide information on how to feed their baby once their baby's born. We do heights and weights on kids every day and monitor their weight and also their iron levels and give education on how to keep the healthy weight and healthy irons as kids, as that encourages them to grow. So we also work with the pediatricians in town with the kids on their weights and their irons, and also on feeding. Although we are a breastfeeding program, some moms do provide formula for their babies. So occasionally we have a baby who doesn't tolerate a formula very well. So then we'll work with the pediatricians to figure out how we can get that digestion working in that baby so that they can eat healthy. And sometimes they have trouble vomiting and those type of things. And so we work with the pediatricians in Siskiyou County to help kids to be able to eat and grow. There is a WIC program in every state, every county across the United States, including military bases, and also overseas at the military bases. We provide WIC services for our US military personnel. So I also had the opportunity to work in another county for WIC in Yuba County, which is in Marysville. And we did provide services for Beale Air Force Base, which was very cool to be able to go onto the base and provide services for those parents and families. So, and we, even though we are called the Women, Infants, and Children, we do also single dads who have children. We also provide services for their kids for healthy foods. All the healthy foods that we give children are designated by the USDA, which is the United States Department of Agriculture. So they determine which foods we give the families, and they get specific healthy foods like fruits and vegetables and milk and cheese and eggs, and they get that every month. And so they come to their appointments about once every 3 months, and we meet with them and do a lot of counseling with nutrition and sometimes other types of counseling when moms are just having a hard day. Sometimes we do a lot of listening and just being there for moms, which is a really rewarding part of our program. We have different jobs in the WIC program. We have, you start off as a WIC nutrition assistant, and it's kind of the entry level. WIC does training for the employees that come in. So that's all, it's about 1 year worth of training that you're provided through the WIC program and through the state of California and through public health. in order to get to that point where you can then sit down and counsel the moms and on nutrition for their kids. There are also required employees in the nutrition in the WIC program to carry a certified lactation educator license because we do a lot of breastfeeding education for moms. So, and that takes, that's 40 hours of education. So usually we do a full week of just one full week of all education, which is provided through usually we've done it through Evergreen Perinatal, which is out of Washington, and a great program. So, and then as we just follow these moms, we keep moms on the program while they're pregnant and postpartum, like I said, and then children are eligible to stay on our program from birth till they're 5 years old. So we followed these families for a long time and get to know them and be a part of their life. And as Shelley talked about the COVID, this has been pretty tough on our moms. So we've done a lot of talking over the phone now that we're seeing people in person again, but before talking over the phone and just listening to moms about how hard it is to be home with their kids. And sometimes it's not always about nutrition. Sometimes we just need to listen. So we wear also a lot of hats running through the WIC program and across the country in Siskiyou County, and get to see a lot of different families and get to know a lot of people and make a lot of relationships with moms and help them see their kids grow and help them through a lot of problems nutritionally and physically, and work with the state and the doctors in taking care of those kiddos. So that's kind of my view here on the WIC program, and I am going to pass the torch on to Thana Webb.
Thank you so much, Tracy. We're looking forward to hearing what Thana has to say on school nursing. And remember, if you have questions, please put them in the Q&A and we can address them or come back around if you have some.
So this is Thana. Can you hear me?
Yes, wonderful, Thana.
Okay. So I don't know how to make me bigger.
Actually, the schools can adjust their screen from gallery view to speaker view, and they will adjust what they see. So relax. Okay. Thank you.
Okay. Okay, thank you. So I always knew that I wanted to be in the medical profession. In junior high, I thought being a missionary doctor was just going to be the best thing ever. And then in high school, I wanted to be a nurse, and I did what they had then was a candy striper program. So I had a cute little red and white uniform that I would wear to the hospitals, and I would push people in their wheelchair to wherever they needed to go and make beds and feed some people. And it was all volunteer stuff as a teenager. And once I finished high school, then I became a nurse's aide and did vital signs. That's blood pressures, temperatures, pulses, and did baths, and just did a multitude of things as a nurse's aide. And then while I was going to nursing school, I was a ward clerk. That means when the doctor writes something down, I would make sure everything happened that he wrote. If he said a diabetic diet, I would contact the kitchen. If he said traction, I would go get the traction and set it up. If he said lab works, I would make sure that happened. And that was a great learning experience because I got to know every part of the hospital and who did what and where. So I graduated from Shasta College with my AA degree in nursing, and took my state test to get my license. And after that, I have had a license in other states, in Colorado and in New Mexico. And California has such high standards for nursing that it's really no problem transferring and getting a nursing license in other states. After I got my AA degree, I worked some in the ER at night, and then I got a job on the mental health ward. And that was a wonderful experience. I worked there for 7 years part-time, 3 days a week, and on the surgery floor a couple of days a week. And I learned how to talk with people. I learned how to ask questions when they were talking about being suicidal. And most of all, I learned how to be patient and to listen. I was also taking classes at night through Chico State to get my bachelor's degree and my public health nurse degree. And one of the teachers ended up being a mental health patient. She was a new mom. She moved there to teach, and her husband couldn't get a job, and it was just overwhelming for her. And that was the most valuable lesson, that anybody can end up needing counseling and needing mental health help. And the only difference between myself and my patients was that I had a great resource system. I had friends and family and church people that supported me. So that was a very valuable lesson. My husband had a job where he had to travel a bit. And so we moved from there to Colorado, where I worked in a couple of small hospitals on the medical surgical floors. And with patients in the hospital, you have to bug them constantly. At least every 4 hours, you're listening to their lungs, you're checking their pulse, any wounds, you need to check those out. And so that was just part of good nursing care. I also took some cardiac classes, heart classes, and I can read those little squigglies of your heart, and I can tell the ones that are dangerous, life-threatening. So I could do the heart monitoring. And then we moved from there, and we moved to Hollister, California, where I got a public health job, and I loved it. I loved working public health. Most of my job was visiting new moms and new babies, and just making sure that the babies were healthy and growing and eating, and that the moms were recovering. And I did some immunizations and some family planning, but it was mostly kids. And I worked with the California Children's kids, and I think they already explained that's kids that have a disability, like maybe they had a heart problem and they're going to need to see a heart doctor for years. So I worked with those children, and it was a wonderful job. I also worked nights there as a IV nurse, in-home IVs. So people who were at home and maybe needed antibiotics every 6 hours, I would go in at midnight and hook up their intravenous line and give them their antibiotic. And you really have to trust people to let them in your house at midnight to mess around with things that are plugged into you. After that, my husband moved again, and we moved to the little town of Weaverville, where I worked in the hospital, and I asked to be trained to do labor and delivery, which they were very happy to do. So I taught classes about pregnancy to pregnant ladies and their spouses. I taught CPR and first aid, and if somebody came in that was in labor, I stayed with them and with the baby. And then I took a traveling nurse job, and that was exciting. We went to New Mexico, and I worked in the emergency room and in their baby maternity ward. And I did that a couple of times, but I had children, and my children were not excited about moving around all the time. So we had some land here in Siskiyou County. We had it for years and years. We bought it as an investment, and Fairchild had an opening in their maternity ward, so we moved here. And then there was a school nurse opening, and I thought, that looks like fun. So I started working as a school nurse. So all school nurses are public health nurses. You have to have a bachelor's degree and a public health nurse certificate to get the job. And then you have to go back to school again. So I had to go back and get a audiometry certificate. That's so I could do hearing tests. And once you have a school nurse job, you have 5 years then to get your school nurse certificate. So that was another 1.5 years of schooling. And fortunately, by then, computers were in the world, and I was able to do that online. So I got my school nurse hat, and I became a school nurse. Now, this is actually an old nursing hat. It is one that Shasta College had in 1974. And back then, you knew nurses by what college they went to or what nursing school, because we all had different hats. And some of the hats got pretty elaborate. But they decided that hats were germy, and they got caught in all the lines. So we no longer wear hats. So once I started working as a school nurse, I found that all those other nursing jobs were very helpful. As a mental health nurse, I was able to talk to kids, talk to staff. As an emergency room nurse, I knew what to do with seizures and blood sugar levels. And as a cardiac nurse, I knew something about the heart, and when we had kids with heart conditions. And then the vision and hearing things, I had also learned. And we also work very closely with public health. If we have a contagious disease like mumps or measles, we work with the health department, and being a public health nurse was also very important. Now, looking back, I did see that I took some classes in high school that I just thought were fun, but they were actually quite helpful. So I took speech in high school, and we had to be able to get up in front of the class and give speeches and have some sort of opening and body and closure. We did debate, and that was very helpful because school nurses do a lot of teaching. So we teach family life, we teach CPR, first aid, EpiPens. I've taught heart classes and even got hearts to dissect. We may be teaching someone about their diabetes and what their diet needs to be. So there's a lot of teaching with school nursing, and that speech class was very helpful. I also took a drama class, and I never was in a school play, but I now sometimes put on my pink wig and go in as the tooth fairy. And I teach kids about brushing and flossing and eating healthy, seeing the dentist, wearing a mouth guard if needed. So drama was another class that was really quite helpful in nursing. I also took Latin in high school. They told me that there were a lot of words that in medical terminology that had a Latin base, and that is true. But unfortunately, the Latin I took taught me the days of the week and the months of the year, and it did not teach me medical terminology. But there are some classes now in high schools that do teach medical terminology, and I know Wairika High has that, and it would be a great class. I really, really wish I had taken Spanish in high school. When I worked as a public health nurse visiting those moms with new babes, I had to take a translator with me probably 1 day a week just to translate. And when I was a school nurse up in Doris, which is 48% Hispanic, I would have to get a translator. And just last week, for a more local school, a child told me certain problems. I said, I'm going to call your mom. I called mom, but I could not communicate well with her, and I had to get a translator to speak Spanish. So I would really recommend taking Spanish if you can possibly do that. Sometimes I also dress up as a clown, and I have a sign on me that says, don't clown around with your health. And these are some of the things that you should do to be healthy. So I worked 20 years as a school nurse, and then I retired. And it was a financial thing. I made as much money retired as I did working. So I thought, well, I think I'll retire, but I lined up another job. And I worked for the tribe as their public health nurse for a year. And it was mostly working with elderly people and diabetics and doing diabetic luncheons and education. And my family had some changes in that year, and I really felt that I needed to work part-time. So I came back to school nursing, and because I'm officially retired, I can only work part-time. And I'm so glad to be back with the children, and I'm spending my days off with my grandchildren and my family that had some medical needs. So I've had a great many nursing jobs, and I loved them all. And I really feel that nursing, for me at least, was more than a job. It was more than an occupation. It was more than a career. It was a calling. And I've had 47 years of nursing. So I'm kind of on the tail end of nursing. I shall continue to work as long as my family needs don't change and my health is good. And I have loved all of it. I do want to mention that while working for the Crook tribe, if you have the opportunity to work for them, they pay for you to go back to school. They paid for my classes on advanced life care. They paid for my nursing license. And they are a great resource. If you are working for them, they help you with your education. So I think that's all I have. Oh, I do have to say that in 47 years of nursing, I did take off a few times. I have 4 children, all grown. So I did take off a 6 months at a time. And one time I took off 2 years when I had 2 children.
Thank you, Tana. You actually answered one of the questions that was in the question box, which is how long have you been doing this? So 47 years, that's amazing. Amazing. Thank you so much. I do want to remind our participants that when you type into the Q&A, you are typing in for all to see. It's not like a chat where you can just chat with your friend during some sort of an event. So please only put questions in there that would pertain to the speakers and what they are speaking. And as a side note, we are going to take a 15-minute break here at about 10:10. We have one more speaker in this pathway, and in the next pathway, we have 3 speakers. So if you could just hold out just a little bit longer. We've got Ann Merkel, who is a health educator pathway, up next. Ann, it's all yours.
So good morning, everyone. My name is Ann Merkel, and I'm going to probably jump right into my presentation. But I would like at the end to maybe talk to you a little bit about my career path. So I'm going to be sharing my screen. And getting started.
Looks great, Ann.
So welcome to my career as a health educator. I am in the tobacco education program. And what I'm hoping that you'll learn a little from me today is about what a tobacco education project is, which is my assignment, what we do, some of what we do, in hopes that you will consider a career in public health someday. Also, you're going to be seeing what I actually do on the job. We educate on the health and environmental risks associated with tobacco and nicotine products like smoking and vaping. I'm also going to talk to you about what you can do to address the smoking epidemic, the smoking problem in our public areas in our community. So what is a tobacco education project? We work towards, one of our biggest goals is to limit youth's access to tobacco and nicotine products. They're harmful for your health, and we want to educate our children, our youth, our whole community. We also educate on the harms of secondhand smoke. And we also work with your local government agencies like your cities and your counties to try to adopt policies that will stop things such as having smoking allowed on a playground or a beach. And you can see the image on the left of your screen there This is an image that's put out by Tobacco Free California to help promote some of these programs. We also work with community partners like the school that you might attend to work on these projects. So what do I do? Day to day, I have a variety of functions. One thing that we do is we actually get information from our community. So we reach out to the people who run your schools. We reach out to our community partners so that we can gather information to find out what kinds of problems are going out in our community related to health. We also create groups of people. So for example, one of my jobs is to create a youth group in a school, and I'll talk a little bit more about that later. You can see a picture at the bottom of a health educator working in a classroom. We also provide help to the community. So for example, if someone was trying to quit vaping or smoking, we have resources to help them. And I find that personally very rewarding. It's a big part of my job. And like today, we provide education. You're seeing an example of a presentation that I could be giving in person. I wish we were in person, but we're not. And why we do it is we want to keep you healthy and we want to keep you safe. We want to have clean air. We want to have smoke-free areas so everyone feels healthy and has a great place to live. So I'm going to show you a video. This video was produced by the California Department of Public Health. And this is an example again of another tool. It's a very short video. Hope you find it interesting. And here we go. Okay, so I'm not sure if you all be able to comment, but I have a poll. What is the message in the video trying to relay? It's multiple choice. And in your setting, if you can, at the end of the options, you can write in the QA, or if you're in the classroom, you can politely tell your answer. So A, does the video represent smoking and martial arts don't mix? Or B, don't upset dogs when you're out for a walk? Or C, cigarette butts harm our environment? Well, I think it's obvious that the answer is C. Cigarette butts are bad for our environment. You may not realize that cigarettes are made of a plastic material which don't break down. They don't biodegrade. And that can also move not only just on our surface, move into our water supply. Even unsmoked cigarette butts are dangerous to animals, plants, and aquatic life. Clean air and parks are very critical to our community. So why do we want, for example, a smoke-free or tobacco-free park? Well, in parks, as you know, you go there to play. You want to have a healthy activity. If there's smoking happening, breathing secondhand smoke is not good for your health. Exposure to secondhand smoke is especially harmful to children or someone with asthma or a pregnant woman. You may not realize that cigarette smoke contains more than 7,000 dangerous chemicals. Non-smokers who are exposed to secondhand smoke are breathing many of these same chemicals, including 70 chemicals that can cause cancer. Tobacco-free policies, which we work towards when we're a health educator, reduce the number of youth who would be experimenting with or around tobacco. So another reason we educate is vaping. I'm sure many of you have seen this or heard about the dangers of vaping. So I have a quick quiz that, again, you can put your answers in the Q&A if possible. The first question, these are true or false. Flavors entice youth to try vaping, true or false? True. I'm hoping most of you know that. Flavors mask the very harsh taste of traditional tobacco products, and they make the product sound fun and innocent, which they're absolutely not. Question 2, vaping and e-cigarettes are not as harmful as smoking regular cigarettes. Is that true or false? False. Youth nicotine can lead to addiction and harm the developing brain, learning, and also your memory and attention. E-cigarettes can also harm your heart. Many of these chemicals many of these chemicals that cause these harms come from flavors. And then 3, vaping has less nicotine than cigarettes. False. The newest vaping devices contain high levels of nicotine. Many of these vaping tools have as much nicotine as 2 packs of cigarettes. So a few more facts that it's important that you know about youth and nicotine. The tobacco industry, these large companies that sell tobacco products, including, vaping and flavored products, they profit, they make money by hooking kids on flavored nicotine. When the product seems harmless, like when they promote the flavors, use by children rises. The tobacco industry uses these fun flavors and devices to hook kids on nicotines. And why are kids targeted? Because it's easier for the developing brain to become addicted. This is a fact that I find very interesting and scary. In the last 2 years, vaping has increased by 218% among middle schoolers and 135% among high schoolers. A few more facts. Until about age 25, the brain is still growing. Young people can become more addicted than adults, and the effect from nicotine can be permanent. Some chemicals common in flavored e-liquids are toxic to lung cells. E-cigarettes contain nicotine, ultrafine particles, heavy metals, and volatile organic compounds. So what can we do about it? What can you as a youth do about it? Part of health education, as I mentioned in the beginning, is creating a youth group or a leadership group called coalition or an advocacy group. And we work together to promote healthy schools in our community. And why do you think you are so important as a young person? Because youth have power. Even though you might not be the age to vote yet, you have a vested interest in having a great environment, whether it be at school or out in the community. Young people can be effective partners in the fight against the tobacco industry by exposing those manipulative tactics that hook youth. Because you're in school and you have friends and community members, you have a lot of credibility with decision makers. You also bring a lot of energy. This energy has a potential to open doors that wouldn't normally be opened. You also bring a really good perspective. So joining a coalition can give you an opportunity to be in a leadership role and participate in public speaking. Additionally, being part of a youth coalition, you can earn community service hours, be part of a positive change in your school or in your community. You can gain experience doing public speaking, build leadership skills. You might be able to get letter of recommendations when you go to college someday, participate in activities. So please watch for youth coalition activities next year when you're in high school. So thank you. That was my presentation. I am going to stop sharing for a minute so that I can just, if there's time, I just wanted to chat a little bit about my my career path. I was also, some of the other panelists, I was born and raised in Mount Shasta. I did move away to go to college, but I also attended community college here in Siskiyou County. I attended College of Siskiyous. I attended a community college in Redding and also Sacramento, but I ended up getting my bachelor's degree at Simpson College in Redding. And my degree started off in human resources and management. And when I wanted to move back to Siskiyou County, I started looking for work in county government, and I worked in human resources, and then I found a new career working in public health. I find it very, very rewarding being a public servant and being part of the public health team. So I hope this is planting a seed for you. I know everyone is tired of the virtual presentations, but I was really glad to be here with all of you today, and thank you so much.
Oh, Thank you, Anne. We appreciate, and all of our panelists. I'd like to just take a quick round of panelists. We heard that Thana had been in her position for 47 years. I don't know if our other panelists are still on with us, but maybe you could just pop in. Shelley, how long have you been in your position? Or have you been in school
5 years.
in nursing?
Oh. Let's see, got my license in 2013, so 7 years.
Awesome. And Anne, how long?
So I was in human resources for about 20 years. Some of that was in healthcare for about 5 or 6 years. And then I've been working in county government about 15 years. And I've been working in public health about 3 or 4 months.
Awesome. Awesome. And it looks like Gabby maybe has popped off already. I don't see her on. So I think at this point, Marion, do you have one more poll for us?
We do indeed. Just kind of a
Okay.
quick recap. Thanks to Siskiyou County Public Health. We're curious what the folks in the audience think about this poll. How many jobs in Siskiyou County do you think there are at Siskiyou County Public Health? Go ahead and reply. We'll be moving to a break shortly. Great, poll results are coming in. We have really quick respondents. And our presenters, if while the poll is running, if you want to all turn your cameras on briefly, we can let our audience say thank you. Thanks, Jamie. I saw that you put your answer in the Q&A in addition to, because we didn't have the number you wanted to say. Thank you. Jamie predicts 20. Appreciate the creativity there. We do want to thank all of the morning speakers so much for being here. Okay, we're coming up on 1 minute. The poll will close in about 10 seconds. Awesome. And we will go back to our Director of Siskiyou County Public Health, share these results. And Shelley, how did we do? Were we close?
We have approximately 40 people employed here. Can you hear me? Because
Yes.
okay.
Thank you very much. I know when that thing's across the screen, it's hard to tell what
Yeah,
we're
you don't know if I'm muted or not.
Yes, we can hear and see you. So those of you who guessed 40 jobs, you are spot on. Kind of nice to know that there are that many jobs in health with that many different roles. All right, Marie, you want to send us off to break? I'm going to put our screen up.
Yep, so we will be on break until 10:25. So get up, stretch, have some water, go outside, run around a little bit, and we will come back and we'll be hearing about the education opportunities that are in our county. Director of Rural Health Institute, Rhonda Brown, will be with us. Kurt Thompson, who directs the EMS program, will be with us. And then we close with another student, Wairika High School graduate, Brandon Swenson, who's going to share a little bit about his pathway. He is in process of applying for medical school and just kind of what he did to get him to, to get him to that point. So we hope you come back after our break and join us. And once we're done with our pathway 2, we'll be pushing out a poll again to our teachers and to the individuals that are on the call with us. Have a good break.
Great. Speakers, you might just want to remember to turn off your camera and microphone while you move around and stretch your legs.
Just want to remind our participants, we're about 4 minutes out to returning to our webinar. We are at a 2-minute warning.
To bring us back, Marie, I'll relaunch that poll that asks our folks where they're watching from, since we had a few join us.
Sounds great. Thank you, Marion.
So as you come back into the webinar from your break, let us know where you're watching from. Even if you answered earlier this morning, we had, that was before everybody had joined, so we're happy to hear from the whole crew. We know you're watching from a variety of places, whether it's classrooms, distance learning, at home, on your own device. Any which way, thank you. So I have somebody in the Q&A saying watching from Dunsmuir.
I want to remind our panelists from the earlier session that if you have the need to step off, please feel free to do so. We are into our second panelists, which are Rhonda Brown and Kurt Thompson, and Brandon Swenson should be joining us here pretty soon. So please feel free to step off if you need to move on to your job for the day.
All righty, so here's where we're hearing from folks. And we had one in the Q&A watching from home. So that would add 9 to that. So it's looking like the majority of you are joining us from your distance learning home access. Thank you so much. And thank you to the teachers who were able to get the webinar link to students so that no matter where you were today, you could join this virtual field trip. Feel free to keep using the Q&A feature as questions come to mind that you would like to ask the panelists at the end of the session, or that if you have any questions about how this is all working. A recording of this event is going to be made available, and that will be shared with all schools in the county, so that if some of your classmates may not have been able to attend, it will be available in that other form. I think we're there, Marie. What do you think?
Okay, great. Bri, did you get a snapshot of that poll?
That's okay. I think I still have that one. I can pull it
Sorry.
up.
Awesome. Okay, sounds
I
great.
already got it. I got it.
You got it? Yeah.
Sounds great. So next we'd like to pass it off on to our next presenter, which is, I believe, Rhonda Brown. She's going to talk a little bit about the educational opportunities for nursing and healthcare here at College of the Siskiyous. Rhonda, it's all yours.
Hi. So I'm Rhonda Brown. I'm the director of the nursing programs at the College of the Siskiyous. And from what you've already heard this morning, there's all kinds of options if you become a nurse. So that's one of the great things about being a nurse is there's so many different jobs you can do. So you're never bored anyways, no matter what job you're doing in nursing. So the other thing is that your license is very portable. Shelley mentioned that earlier. So once you get licensed in the state of California, which is one of the most difficult states to get licensed in, and we have a 92 to 100% pass rate for getting a license. So we have a very good program. I'm very, very proud of it. So you can go from state to state, and what happens is you get an endorsement. So you send your college transcripts and your results from your NCLEX, which is the board that you have to take to get licensed. And it's pretty much just a fee, and you can work anywhere in the United States. They also have something that 20 of the states right now is called a compact. So all those states together, if you get licensed in one of those states, you're licensed in all 20 states. So they're actually trying to work on making that across the board. But I have a feeling California will be one of the last ones to sign on, just because they're just very strict about a lot of things. So here at the college, I just want to let you know that you have the opportunity to become a nurse, a LVN or an RN locally. We also have a CNA program, which is a Certified Nursing Assistant program. And you can join that program as early as age 16. So we tend to run those programs during the summer. And during the summer, we have a lot of high school students that actually come and do that job. So for a certified nursing assistant, it's the entryway into nursing. So you learn how to take care of people, how to take blood pressures and temperatures, how to give baths, how to feed people, things like that. So you're really assisting the nurse with a lot of the basic care. Places that you can work with that is a skilled nursing facility or an assisted living facility. Some of the hospitals, for example, Fairchild Medical Center is now hiring CNAs because they are opening up a few beds that are for people that have more skilled needs. So that's something to think about in the future as well. One of the things that we're looking at as far as our curriculum is requiring students to have a CNA certificate prior to getting into our licensed vocational nursing program. Because what we find is that people come to school and they don't really have a good idea what a nurse does. So they get here, they're here for about 5 weeks and they decide, oh geez, this is not what I want to do. So if you go through the CNA program, you'll have a really good idea of what nursing really is. So that's highly, highly recommended. So when you come to school here, we have a state-of-the-art simulation and skills lab. We're very, very proud of it. I'm going to show you some of the props. They're behind me, and I'll bring them close to the screen at the end of my talk here. And then you also do clinical experiences. And a lot of the speakers that spoke today, when you're in the RN program, you do a lot of your clinical rotations in the different areas of public health. So you'll go to the jail, you'll go to behavioral health. You might do WIC, you might do the Healthy Siskiyous van. So we really give you a good opportunity with our local partners to get an idea of what kind of things you can do as a nurse. And a lot of times our students get hired. So especially at the 2 local hospitals, we are really a pathway for them to get new employees. We also, as far as clinical, we go out of the county as well for our registered nurse program because the Board of Registered Nursing wants you to have critical care experience. So we do go down to Reading, we go to Shasta Regional Medical Center, and we go to Vibra. For mental health, there's a mental health unit at Shasta Regional Medical Center, and there's also one in Red Bluff. It's a inpatient psych hospital that takes care of children and adults, so you get that experience as well. And then we have a very, very special and precious pediatric rotation where we have partnered with Shriners Hospital in Sacramento. And you get, we do it like in a 3-day period. So you're just traveled on once and come back. It's a great experience. The students get to take care of children in their intensive care units, and they have a huge burn unit. So you get to learn about that whole process as well. So, and then you learn play therapy and all the other things that kind of come along with when you're working with children. So for the licensed vocational nursing program, there are some prerequisites, and one of them is medical terminology. And Santa said you can take that during your high school career, so that'd be great. And then you have to take anatomy and nutrition. It's an 18-month program, so it's 3 semesters. And then you can sit for taking your boards to become a licensed vocational nurse. So Abby had a really nice slide presentation, and she kind of, showed you the different career paths. So LVN is like the entry-level nurse. So you can give medications, you can give shots, you can, participate in treatments and things like that, but it's still entry-level. And then for the RN, that's the professional nurse standard. So that's the highest licensing level. And with that, you have all these opportunities that, everyone at Public Health explained to you. So it just really broadens your horizons. So at the College of the Siskiyous, we have the associate degree, which is the first level. And then what's so wonderful now is they have a lot of online programs to get your bachelor's and your master's degree, just like Shelley mentioned. So you can actually do your entire education here in Siskiyou County, even though, your bachelor's and master's may be online. So in order to be a higher education nursing educator, you do have to have at least a bachelor's degree. And with that, you can work with the LVNs, and you can do clinical for the RNs. But to work in the RN program, you have to have a master's degree. So those are some of the stipulations. So there is a long path of education, but you just learn everything, as you go on. So as far as nursing, nursing has been around for a long time. It used to be, people at home would take care of the sick, or religious orders would take care of the sick. But Florence Nightingale, who is the mother of nursing, I have a little doll picture over here. So this is her this is kind of what she looked like. So she's the one who was she's who brought together education in nursing. So she was a very bright woman, and she came from a very wealthy family, and she wanted to do public service. So she actually volunteered to be a caretaker in the Crimean War. And what she found there is that they were not washing their hands, and that that the patients were in very, very filthy conditions. So she's actually recognized as the mother of infection control. So she's the one that really got hand washing going for the entire medical profession. So she really did a lot of things for us as far as bringing things up to standard and keeping people healthy. So after she was done in the war in 1860, she started her own nursing school, and that was in London. And that was the original way that nurses were trained. It was hospital training. Actually, that's how I got my training. It was a diploma program, and it's 3 years of a lot of really hands-on stuff. So those programs are kind of going away now, which is sad because I think it's a great education, but we do the best we can to make do. So one of the other things I wanted to show you is that one of the badges of honor as you graduate from these different programs is that you get a pin. So the top pin here is the Certified Nursing Assistant pin. And then this middle one here is the LVN pin, and then we have the RN pin. So as Thana had talked about, we all had hats that represented our school. We also had pins. So when we graduated, every school had their own pin, and you'd wear the pin as a rite of passage, as a badge of honor, and things like that. So that's the history of the nursing pin in short. Now I want to show you some of my props here, okay? So we have in our sim lab, we have all kinds of mannequins. So this is the simplest type mannequin we have. This is Gertie. So she is a geriatric patient. So it actually like has, older skin and, problems that, people develop as they get older. So you learn how to take care of elderly people. I have here the adaptive equipment for someone who has a hard time with arthritis. So what you'll see is a lot of times the plates are deep, and they also are divided. So sometimes if people have vision problems, what we can do is we can tell them, 2 o'clock is where your vegetables are, okay? 6 o'clock is where your meat is. So that's how we kind of prompt people. And then these are utensils that are bigger. So people that have arthritis, they can actually grip things and they can still feed themselves. So one of the things that we really teach our patients is and try to promote is as much independence as possible, because it really helps with self-esteem. So this is Gertie, and we're going to move Gertie out of the way now. And this is one of our infants. This is the cutest one we have. So this one is pretty low tech. We actually have, it's swaddled, but we actually have, the baby has a intestinal feeding tube in there. So we teach students how to do that kind of a treatment, because one of the things that we talked about in the other sessions is about how nutrition is so important for our patients to get better, and that's one of the things that we do. So here I have another one of our tools, which I'm going to have them hold it up for me here. So this guy here, it has a really nice clear plastic over it, so you can see the bones, the veins, and the arteries over here. So when we're teaching people how to give injections, it's real important that you know what the anatomy is so that you don't give the injection wrong. So I'm not sure if this is going to work or not, but as we're teaching students how to do injections, it will either, so I got into a pretty good place there because the alarm didn't go off. So if I went down here and this is definitely a wrong place to put it, the alarm would go off and I would know as a student that I didn't get the right anatomical area to give the shot. So that's one of our props as well. And then the last one I wanted to show you. So one of the other things that you're learning about as you're a nurse is how to assess things, because you're the person that's going to be there first. So you're gathering all this data and information for the doctor. So one of the things you have to learn is heart sounds and lung sounds. So this is how we practice. See if this is going to work now. It's going to work this morning. Okay, somebody's not working now. So, so we can program it to listening to the different heart sounds, okay? And then there's different areas to different kinds of problems. So if you have like a valve problem or any kind of arrhythmia type thing, we can do that. And then actually lung sounds, so we can do lung sounds all over, and we'll actually tell you. So there's different lung sounds that you look for. So if you ever had a cold or if you have asthma, you may have had some wheezing, so we can demonstrate wheezing or any kind of crackles in your lungs so that the students can get to understand what the sounds sound like, so that when they're actually doing it on a person, they can hear it. Oh, there it goes. There it goes. So there's the heartbeat. So this is an abnormal heartbeat, okay? This person has a mitral valve problem. So there you go. All right, that's good. I think that's a good one. Okay, great. And then of course we talked about having to take anatomy. So and we're always looking at anatomy and relating disease and health to anatomy. So we have all kinds of models to help you with that as well. So I just wanted to tell you about my career pathway. So I've been a nurse for 42 years, a little bit less than Thana. And I started out as a psychiatric nurse. I've been a psychiatric nurse most of my career. I've also done hospice and public health. So one of my public health jobs is on the HIV/AIDS case manager for the Ryan White funds for Siskiyou County, and I've been doing that for 15 years. And I love public health, and public health is so good to us as educational opportunities for our students. So that's a very nice alliance that we have with them. Okay, that's all I have. Any questions?
Did you want me to run your video, Rhonda, or are you good?
Oh, that's right, the video. I forgot. Oh yeah, so the video is really cool. So it'll actually show you what the simulation lab is. So you can
feel free to talk over it too. If the sound is good, you can talk over it.
Okay.
Play.
So in the simulation lab, we actually have very high fidelity mannequins in there. We actually have 2 little ERs set up. So you go in there and we can put scenarios into the computer. So the mannequin actually has different heart rates and breathing, coughing. We can, have them go into cardiac arrest and things like that. So when you were seeing them going into those 2 rooms, they were actually going in and doing a simulation on a code. We have a maternity mannequin that actually delivers a baby, which is great for OB. And then we have a couple of different infants that we do critical care for newborns. And then we have some children models and we have some adolescent models. So you learn how to take care of, all kinds of patients through the lifespan with all of our mannequins. And we set up scenarios so you feel comfortable when you get out there and actually have to, do this on real people. So with the COVID, it's been great because a lot of the companies, especially Lairdral, which is our mannequin company, they have come up with a lot of online scenarios that we can, bring into our online stuff, which we had to do a lot of that during the spring, but we've been blessed so far with the low COVID rate here in Siskiyou County for this semester. So we've been hands-on and in person, and it's been going great. So you're welcome to come and schedule a tour anytime. Typically what we do is you actually come here and you go to the lab and you actually get to play with everything, but we can't do that right now. So thank you for listening.
Thank you, Rhonda, so much. We really appreciate that overview of what is available in the Rural Healthcare Institute education options. So I'm going to tag next Kirk Thompson, who is going to talk about, what was that? Okay, so Kirk, we're going to go to you. Take it away.
All right, good morning. I'm going to run my video first and then I'll talk, and it's about as short as Rhonda's. So here we go. Oh wait, share screen. There it goes. Okay, so theoretically that came through pretty good.
Yes, it did. Thank you.
All righty. Well, good morning. My name is Kirk Thompson, and I run I'm the EMS EMS coordinator, which stands for Emergency Medical Services, and I'm also the paramedic program director here at College of the Siskiyous. I'm a retired firefighter back in February, and I've been a paramedic for about 15 years and an EMT for years before that. At the College of the Siskiyous, we have a whole bunch of different programs that you can take, and that is starts with what we call EMR, which stands for Emergency Medical Responder, and emergency medical responders are kind of like the beginning first aid. They can do something called CPR, and it's required for a job or career path. You take the EMR class to go into what we have the fire academy here at the college. So the students have to take the EMR class. It's 7 days, it's 7 8-hour days, but you can have that done in a week. And then the next level we have is EMT, which stands for Emergency Medical Technician. And if you want to become an EMT, a lot of fire departments require that to get a job with them. EMT takes about roughly a semester, 4 or 5 months worth of training and skills. And there's a component where you have to go into the hospital and do some what we call ride-along time. So you get to ride along and experience what it's like. EMTs are, if you see an ambulance driving by, EMTs are typically the drivers of those ambulances. They go on medical calls and they can do search and rescue and things like that. And then if you really like being an EMT and you want to go do something different, or you push things like medications and help treat people even better, you can go onto our paramedic program. And our paramedic program is, well, it just started. There's students in the classroom over there. and which you can't see, of course. But it started last week. So it starts in October, and it'll be completed. Those students will graduate and be done in about 12 to 14 months. So a little over a year, and they'll be a paramedic. And what paramedics get to do is it's a lot of schooling, almost not quite as much as nursing, but we get to give medications and all those shots and all those IVs and things like that. We can do that out in the field at like a car accident or something like that. So you can get a job as a paramedic. You can get a job in an ambulance. You can get a job with a fire department. A lot of fire departments have paramedics on their fire engines. It's just, it's a handy skill to have because, well, not just because I've been one for 15 years, but so we offer these different aspects that you can do. And the training is intense, and we use almost all the same cool props. I'd show them, but most students are using them right now in the classroom. So we use a bunch of cool props and things the same as the nursing program. Just the nurses work in the hospital, and we work out on the front lines. We pick up people, in their homes. We pick up people in from car accidents, and maybe they fell off a cliff or they got stranded on Mount Shasta. Those of us in our EMS field, or the emergency medical services field, we're kind of out there on the front lines. We're the first people that most of the people see. If you call 911, we're the people that show up at your house, and we try to help solve your problem. At least if you call for 911 if somebody's sick or doesn't feel well. From there, you can, a lot of our paramedics, I've known many paramedics that have gone on to become nurses. A lot of paramedics will go on to become doctors. Matter of fact, in this year's class, I have a doctor who wants to learn how to be a paramedic because they learn all the hospital skills, but they don't learn how to package up what we call patient packaging. So we put them in a splint, like a whole body splint, and we put stuff on their neck, which is a collar, and we can stop the bleeding. We can do all sorts of cool stuff in the field. As a paramedic, I can give medications. I can give, we can do a kind of, shock therapy, kind of what you see on TV, but it doesn't work exactly the same way in what we call the field. So we do all that stuff, and we can do almost everything a doctor can do. If somebody has a heart attack, we can do almost everything in the field to save their life if somebody's doing CPR that you can in the emergency room. So our training is ongoing as well, and we take some of the same classes as nurses, such as, for your heart problems. We take ACLS, which is Advanced Cardiac Life Support, which cardiac is just a fancy term for your heart. And advanced just means we do extra stuff. So if you want a cool job, you don't have to work in, it is the healthcare. It doesn't, you don't have to work in a hospital. You don't have to work at any places like that. You can work in an ambulance, drive the roads, and maybe work for a fire department. I became a paramedic to get a full-time job as a firefighter. I've been a firefighter for 30 years, and I was a volunteer, and I ended up getting a full-time job just because I had to go. I went out and got my paramedic license. I was an EMT, which is the emergency medical technician, for many years before that. But the places I was looking to get a job was, they were requiring paramedic level. So other paramedics go on. There's a few more classes after that, and they learn to, they fly on helicopters. So the helicopters that fly around and pick people up and transport them, there's a lot of paramedics there. You can work. CHP has paramedics on some of their helicopters. I know some of the helicopters that had, like the sheriff's departments down in the middle, like near San Francisco, some of their sheriff's department helicopters have paramedics on there. So a whole bunch of different avenues of career paths that you folks could take if you're interested in going down the EMT, emergency medical technician, or paramedic path. So at this point, I'll open it up to any questions.
Thank you so much, Kurt. That was a great overview of everything that College of the Siskiyous offers. We finally have Brandon Swenson, who is a student, a graduating student from Wairika High School and a graduating student from Oregon State University. I'm going to pass it off to to Brandon.
Perfect. Thank you, Marie. Hey everyone, my name is Brandon Swenson. As many of you guys know, I'm Dr. Swenson's child. If you've had Dr. Swenson either as my mom or my dad. Right now, I actually just graduated from Oregon State this past spring. I graduated in a degree of biology with a minor in chemistry. I'm a 2016 YHS grad, and I've been in Wairika all my life. I have a bunch of questions I kind of wrote down, things I would have wanted to ask myself as an 8th grader going to high school. One thing I would do the same, knowing what I did in 8th grade, is to continue to work hard in school, focus on your grades. I think it's important. Your GPA actually can lead you to a lot of money. You know, it's hard to see that as an 8th grader, what good grades can do. But one thing I really enjoyed and really helped me out was my senior year. When it came time for scholarships, was my GPA was pretty high. And it led me actually to a lot of money. It helped me pay for college. There's a lot of great scholarships and great programs around the area in Siskiyou County that love to help students in our area go to college. So I'd say that's one big thing that you guys should continue to do. One thing I would do different, I was not a very organized student growing up in high school. One thing that really helped me become successful in college was creating a calendar. Creating a calendar allows you to make sure you planned everything out. It starts your skills for good time management. Making sure you know when your assignments need to be due, when you have obligations for other things. In high school, I think it's important to start to get to know your teachers. Really make sure, especially since everyone has changing classes, to get to know your teachers, talk to them, and never be afraid to ask for help. I think it's so important to ask for help when you're struggling in order not to fall behind. I think a lot of students are afraid, but every teacher I had in high school was always super helpful, super nice, and they never felt, or they always went the extra step whenever you felt like you needed that help. Also get to know your advisors as well. I know at YHS, my advisors were Mr. Troutman and Mr. Freitas. Those are the people for a lot of kids that want to go on to the next step in college and look into a career in medicine. Your advisors are going to be the ones that are going to set you up, help you look at colleges, help you take the right classes, prepare. I know at YHS they have classes for pre-med health, health careers. Those are all great classes you guys should take, whether you're interested in health career or not. I remember growing up, I never wanted to be a doctor until my senior year in high school when I took anatomy. And then everything kind of changed, and I realized, ooh, I like life science. I like being around people. And so I'm glad I took that class. I'm glad I broadened my horizons and helped you see what's all out there. I'm going to talk a little bit about the medical school path and what it takes. So for med school, you need your four-year degree, your undergraduate degree, your bachelor's. So I did my 4 years at Oregon State. And like I said, I got a bachelor's of science in biology. After that, you're going to then apply to medical school. There's a couple different medical schools. I know Caitlin applied to an osteopathic school, which is a DO. And then I am applying actually for my MD, my medical doctorate, which are just a little bit different, but at the end, most people don't know the difference between MD and a DO, as they're becoming more similar in careers. And then after your medical school, you would then apply to a residency, which is like a paid internship, and that can last anywhere from 3 to 7 years, depending on whether you want to be a family practice, a pediatrician, or a surgeon. So what I was always taught, it was like once I graduated high school, it's like going through kindergarten through high school all over again. I'll have to let you guys know, it's been so much fun. I am so happy I've done this. It might sound like a lot of school, but if you're up to the challenge and you find the right fit and you think healthcare is a way for you, I would highly suggest pursuing it. It's been a blast. I've met so many nice people. College has been so much fun. School's been so much fun. I really suggest doing that. Going into like kind of applying to college for a little bit. Everyone starts to apply to college around their sophomore, starts looking around colleges around their sophomore and junior year. Again, there's another great set of programs around YHS in the area in Siskiyou County that have college tours. Now everything's going a little bit virtual, so there's a lot of virtual tours set up. So you guys could hop on right now onto the internet and take a virtual tour of campus. I think the biggest thing applying for college is getting to have your service hours, having your service hours documented for community service, and just finding a place that you want to go. Don't go somewhere because it's a big name school or because you felt like they have a cool mascot. Go there because you feel like it's another place you could live for 4 years. Talk to your advisors about community colleges. Community colleges are such a great option for our area. They help students out a lot and they help with cost. So again, talk to your advisors, community service. If you do 2 years of community service or community college, then transfer to a 4-year, that'd be awesome. And then one other thing I would say in high school that I really enjoyed that helped me be prepared for successful in college was I got involved in high school. I got involved in sports, ASB. I went to dances. I did all the cheesy things like that. But in reality, I think it helps you build your social skills. It builds you confidence. They're fun. They're a blast. And I really enjoyed them. And it helps you in college because college is so much fun. There's so many things to do in life. And if you become successful doing social stuff, I've always told people going to college that the way to be successful is become social and make sure you're not burnt out just on school. Is there any questions for me?
Thank you, Brandon. We appreciate that. Hopefully you've had, as participants, a wide view of all of the different opportunities that you might have, both hearing from a student who's in medical school and one who is going to be applying to medical school and the different activities that they've done, along with the plan for, oh yeah, sorry, Marion, you just flipped me and I thought I lost my connection, along with the different opportunities there are here in Siskiyou County. As you know, there are many, many, many more medical professional opportunities here in Siskiyou County, and I'm hopeful that we'll be able to do this again in the spring and bring you more jobs. You can also go to SiskiyouWorks.org, and within this next year, you'll start seeing different vignettes of professionals being posted, video. There's also access to regional and national videos also covering health careers. So Marion's going to put up a couple finalizing polls. We do want to say thank you so much for joining us today. I don't know if there's any final questions in the Q&A. It looks like we're pretty much, there aren't. If you have any, you certainly can post it, but Marion, you want to go ahead and put up the next poll? Okay, so career trivia. What age do you have to be to start the Certified Nursing Assistant program at College of the Siskiyous? So if we take some time and answer this, that'd be great. Awesome, 100%. Oh, a few others. Looks like we have one Q&A. In the Q&A, it says 15. Okay. A few more seconds on this poll. Okay, I think we're pretty much done. The correct answer is 16. So you have to be 16. You can do it in the summer. In fact, we often have a 6-week program that you can jump into. It's a great opportunity to get your feet wet, to determine whether this is something that you really would like to do. And it's offered here, both in Wairika and sometimes in South County as well. It's just a great opportunity. Marion, you want to put up the next poll? Okay,
It's coming, Marie. Sorry about that.
got it. That's okay.
I got to close one to open the other. And this one, we're hoping to kind of hear what everybody gathered. There we go. Let us know what you learned that was new today. You can click on as many.
Okay, so just take a few moments, and which health careers are new to you today, and let us know.
Wow, great. We also in the Q&A have somebody saying, didn't know all of the details about nursing. That was new today. Thank you for that. And the Q&A is still open.
Okay,
A lot of
Q&A is still up. Yep. Thank you, Marion.
All right, let's take a look at what we got here. Here's what you and your folks that you're watching this with are telling us. Looks like folks learned a lot, Marie.
This was a great opportunity to hear from a lot of different professionals. I really want to shout out again to all of our participants who came and listened, as well as our panelists who took time out of their day. We really appreciate it, and hopefully you learned something today. And it looks like we have one Q&A. Great. It was just I didn't know about all the nursing stuff, and that was new to me from one of our participants. So thank you again. Bright, if you'd get a snapshot of this poll. Looks like we're pretty much finishing up, and we will say goodbye to our attendees and goodbye to our panelists. Thank you again, all of you, for joining today and being part of our Health Careers Are STEM. Thank you all. Thank you, Marion, for all of your back-end work.
Thank you, Marion. Thank you, Marie.
Thanks,
everybody.
Thank you. This was amazing.
That was awesome.
Absolutely amazing. Thank you, everybody, for your hard